Welcome to Dr. Xavier's Pod. This is the beginning of an exciting chapter in your chiropractic education. My name is Arnold, Dr. X's AI assistant. Dr. Xavier and I will be your guide and mentors through this journey, but first let's get to know your instructor. His path to becoming your professor at Southern California University of Health Sciences is a story of passion, dedication, and a deep commitment to health and wellness, rooted in his diverse background. As your clinical educator with rich experiences spanning from his early career as an EMT to study medicine and then becoming a chiropractor, Dr. Xavier Ortiz Ramirez was born and raised in San Juan, Puerto Rico, USA. His journey began in the vibrant and culturally rich environment of the island of Puerto Rico. Growing up there instilled into him a deep sense of community and a desire to help others in underserved populations, which became the foundation of his career. From EMT to advanced health roles. In 1991, his professional path started as an emergency medical technician, EMT, where he learned the foundations of patient care. By 1994, he had advanced to a paramedic, gaining deeper expertise, emergency response, and critical care. Recognizing the importance of education in emergency services, he became an American Heart Association AHA CPR first aid trainer in 1996 and an EMS instructor in 1997. Later the same year, he took on the role of a lifeguard instructor for Walt Disney World, combining his love for the water with his commitment to safety and emergency response. In 1999, he took to the skies as a flight paramedic with Aerojet International, an experience that sharpened his skills in high-pressure and critical care scenarios. In 2007, he achieved a significant milestone by graduating as a medicine doctor at Xochicalco University in Mexico. This accomplishment was a turning point, allowing him to delve deeper into healthcare and patient treatment. Continuing his pursuit of education and excellence, he also became an AHA Advanced Provider Instructor in 2008. The same year, he took on the role of a health programs director for a college in Puerto Rico, developing critical skills, but now in the educational setting. After his own experience with a back injury, the world of chiropractic called to him, and in 2018, he embraced becoming a chiropractor at SCU. Yes, he went through what you are going through, and you will too. This new path allowed him to integrate his previous knowledge in medicine with a holistic approach to health and well-being. He worked as a chiropractic occupational health doctor in his private practice Back to Work clinics, and then as an associate in the integrative pain management setting at Savas Health, before coming back to SCU. In 2022, he joined Southern California University of Health Sciences as a clinical faculty member. Here he has the privilege of sharing his varied experiences and knowledge with amazing aspiring chiropractors just like you. Most recently, in 2023, he expanded his expertise further by becoming a Qualified Medical Evaluator, QME. This role has deepened his understanding of the intersection between healthcare, patient advocacy, and the legal aspects of medical practice. He had lots of training and other experiences, but if you want, you could see a more comprehensive bio at SCU website. Let's dive into the heart of our presentation, structured into 9 detailed chapters. Chapter 1, Rules of Engagement. Working under Dr. X license and his supervision is both a privilege and a responsibility. Treat every patient and clinic situations with the utmost respect and professionalism. If you're ever in doubt about anything, his door is always open. If not, knock or send him an email. Professional behavior. Your appearance and demeanor should reflect the high standards of our profession. This includes consistent adherence to clinic attire and proper patient communication. Remember, you're not just representing yourself, but your clinical supervisor and the entire SCU community. Patient interaction. While building rapport with patients is key, maintaining professional boundaries is crucial. Focus on therapeutic communication techniques that foster trust without blurring lines. Embracing challenges. The clinical environment often presents complex cases and challenging situations. Embrace these as opportunities for growth. Learning to analyze, adapt, and apply your knowledge in these scenarios is key to developing a well-rounded clinical acumen. Documentation and record keeping. Maintain vigilance in your documentation practices. Every chart entry, treatment note, and patient interaction record is not just a legal requirement, but a reflection of your clinical competence and attention to detail. Continuous learning. Recognize that clinical education is an ongoing process. Each patient encounter, feedback session, and self-assessment contributes to your growth as a chiropractic professional. Chapter 2, Attendance Policy. Commitment to learning. Your regular presence in the clinic is crucial. If you need to be absent, communicate 24 hours in advance. This isn't just about hours. It's about the commitment to your education and patience. Balancing breaks, learn to manage your time effectively. Short breaks and lunch hours are essential for your well-being, but they should not interfere with patient care. Active engagement and participation. Your active engagement in the learning process is crucial. This includes seeking feedback, participating in discussions, and asking pertinent questions. The more you immerse yourself in these activities, the more proficient you will become in your clinical practice. Chapter 3. Expectations at the clinic. Growth mindset. Embrace challenges as opportunities. You might feel overwhelmed at times, but remember, each challenge is a step towards becoming a proficient chiropractor. Skill development. This term is about building a strong foundation. You won't master everything immediately, but with dedication, you'll see your skills flourish. Self-directed learning. Utilize open labs and technology like force sensing equipment to refine your techniques. This is your time to experiment, learn, and grow. Chapter 4. Navigating Visual Outcomes. VO. VO is the Comprehensive Electronic Health Record, EHR, and practice management software that will be an integral part of your clinical experience at SCU. Understanding and utilizing this software effectively will be key to your success as a clinical student and future chiropractor. Visual Outcomes is a cloud-based platform designed to streamline the clinical, administrative, and financial operations within our healthcare practice. Its robust functionality encompasses everything from electronic medical records, EMR, and practice management to billing, claims processing, and e-prescribing. As clinical students, you will learn how to accurately code so that billings and collections are efficient. Cloud-based access. The advantage of a cloud-hosted system like Visual Outcomes is accessibility. Security and confidentiality. Given its cloud-based nature, Visual Outcomes prioritizes the security and confidentiality of patient data, a critical aspect of modern healthcare practice. The software is known for its customizable, user-friendly interface, even if you think is not. The software's integrated approach ensures that all aspects of patient care, from clinical notes to billing and outcomes tracking, are seamlessly managed. Chapter 5. New Patient Procedures. Notify Dr. Xavier in advance when scheduling a new patient as one of your referrals. Inform new patients that their first visit may take up to 2 hours. Ensure patients with insurance bring their insurance cards or check pricing beforehand. Remember, minors under 18 must be accompanied by a parent or guardian while in the clinic. Patient complaints should never be discussed in the waiting room. Encourage new patients to complete intake forms prior to their initial appointment for efficiency. Clinical student summary for supervisor. Be prepared with a comprehensive summary, including the patient's name, age, gender, medical history, current condition, exam findings, and diagnosis. Ensure informed consent is obtained before beginning treatment. Be aware of any precautions, comorbidities, and medications the patient is taking. Conduct a medical history, provide Dr. X with a list of DDX. After the discussion, perform a targeted exam. Then narrow down the DDX to a working diagnosis and present your case again. After cleaning it up a bit, you and Dr. X will come up with a diagnosis and treatment plan to take care of the patient. Present the report of findings and make sure patients sign consent. Your instructor will guide you in what areas to focus on the first visit, based on the complexity of the case, time, and billing restrictions. Established patient procedures. Clinicians are notified when the patient is ready with a change in color in VO. Conduct an evaluation including physical, orthopedic, or neurological tests as needed. Document progress notes in the VO system. They will be reviewed and signed by Dr. X at the end of the day. No treatment is to commence without a diagnosis and treatment plan approved by a faculty clinician. Unauthorized treatment is a serious violation. Chiropractic techniques. Utilize techniques taught at LACC, primarily diversified. That said, I incorporate techniques that I have learned over the course of my education and certifications. Dr. Xavier. It is common that you will see him using with his patients techniques form activator, Gonstead, McKenzie, spinal traction, Thompson drop table, CBP, or others. He adds, I let the case and patient conditions lead me into the tool or technique that I will be using with the patient, so variety is common. He continues, seems like I'm a mixer, and I am proud of it. I avoid using techniques in a cookbook fashion. You should too. Dr. Xavier. Any deviation from the patient-established protocol requires Dr. Xavier or other SCU clinician approval. Supports and supplements. Any support or supplements recommended to a patient must be approved by your clinician. Clinical students are prohibited from directly providing or selling any support or supplement to clinic patients. Patient referrals. Referrals to other practitioners must be handled by the clinician in charge. Ensure the patient understands the referral reason and whether they should return to our clinic. Provide a referral letter for the patient to bring to the external doctor. Report of findings, ROF. An ROF must be provided before any treatment begins. Use clear, non-technical language and allow patients to ask questions. The provision of an ROF must be documented in the patient's chart. Chapter 6, Patient Safety, Equipment Handling, and Clinic Conduct. In this chapter, we delve deeper into the paramount importance of patient safety, adept handling of clinic equipment, and maintaining professional conduct within the clinic environment. These elements are crucial for ensuring a safe and effective treatment experience for our patients. Patient first, safety and risk assessment. Always prioritize patient safety by carefully assessing the benefits and risks of every procedure. Your decisions should be patient-centric, aiming to maximize therapeutic outcomes while minimizing potential harm. Strictly adhering to HIPAA guidelines to protect patient privacy and confidentiality. This adherence is not just a legal obligation, but a cornerstone of trust in patient-caregiver relationships. Equipment mastery, usage and maintenance. Gain proficiency in using all clinic equipment. This includes understanding operational nuances, indications, contraindications, and maintenance protocols. Regularly check equipment for any signs of wear or malfunction. Promptly report any issues to ensure they are addressed swiftly to avoid any compromise in patient care. Ensuring patient safety in the clinic. Be always vigilant about patient safety. Assist patients as they move in and out of the clinic, especially those with mobility issues, to prevent falls or injuries. Never leave a patient unattended in the clinic. Continuous supervision is essential to promptly address any needs or emergencies that may arise. Keep clinic doors locked when necessary to maintain a secure environment for both patients and staff. Avoid confrontations with patients or their relatives. If a situation escalates, seek assistance from your supervising clinician or clinic security. Maintain your health and well-being. Eat a healthy and nutritious diet, perform regular exercise, and rest as much as you can. Balance your lifestyle in and out of the clinic. Above all, have fun with it. This time will pass, but memories will last your lifetime. In this post-COVID world, it is important of being super aware of the risk of disease transmission. Make an active effort to stay healthy. Employ universal precautions consistently to prevent the transmission of infections. This includes regular hand washing, using protective barriers like gloves and masks, and adhering to clinic and LA County protocols. Creating a safe and respectful environment. Your conduct in the clinic reflects your education, discipline, and professionalism. Strive to create an environment that is not only safe, but also respectful and welcoming to all patients and staff. In case of any incidents, report them immediately to the supervising clinician and follow the clinic's protocols for handling such situations. Chapter 7, Patient Management Plan and Progress Notes. Management plans must be updated as the patient's condition changes, done electronically in visual outcomes and approved by the supervising clinician. Document every patient contact, including calls and visits where no treatment was performed. Follow the SOAP format for progress notes in the VO system. Chapter 8, Clinical Requirements Credits. Welcome to an essential component of your clinical education at SCU. This chapter is designed to guide you through various key aspects of your clinical training, emphasizing the importance of comprehensive documentation, ongoing feedback, and adherence to clinical requirements. Be honest and accurate in your claims. This is part of your ethical practice as a future chiropractor. Formative feedback. Engage actively in formative feedback sessions. These are integral to your learning, providing insights into your clinical approach, patient interaction, and areas for improvement. Treat each feedback as an opportunity to refine your skills and knowledge. Chart audits. Chart audits are more than routine checks. They are pivotal for your learning curve. They will help you master the art of maintaining detailed, compliant, and accurate patient records, a key skill in your future clinical practice. Course of care planning. This involves planning and documenting a patient's treatment journey, which encompasses diagnosis, treatment options, and expected outcomes. It's a critical exercise to sharpen your clinical decision-making skills and ability to develop evidence-based treatment plans. Referral letters. Writing referral letters is a vital skill for effective interprofessional communication. These letters should clearly articulate the patient's condition, treatment history, and your rationale for referral. This skill is essential for ensuring continuity of care and building professional relationships. Other scheduled submissions. Stay proactive with other submissions, which might include case studies, special assignments, or additional documentation tasks. These are designed to enhance your clinical reasoning, patient management skills, and adaptability. Chapter 9, Clinic Hours and Scheduling. Welcome to the final chapter of our orientation, focusing on the critical aspects of clinic hours and scheduling in your chiropractic clerkship. This chapter is designed to clarify expectations and guidelines to ensure that you make the most out of your clinical training while adhering to the college's policies and regulatory requirements. Continuity of clinical training. The Chiropractic Clerkship is a continuous program that doesn't pause for school breaks, unlike other college schedules. It begins with DC Student Clerkship and concludes with the completion of Chiropractic Clerkship 3 based on a 17-week term structure. Therefore, no clinic hours can be earned or applied between the Friday of week 17 and the Monday of week 1 of any term. There are no exceptions to this rule. Clinical hour requirements. To become competent chiropractors, you must accumulate a total of 1080 clinic hours over the course of CC and CCRT&I. The distribution of these hours depends on whether you are on a 3-term or 4-term clinic schedule. Importantly, excess clinic hours do not carry over from one term to the next. Even if you reach the required 360 hours before the end of the 17th week, attendance at all assigned clinic shifts is mandatory until the terms end. Weekly hour limitations. The California State Board limits students to a maximum of 35 hours per week in a chiropractic program, encompassing all classes. Typically, CCI students engage in 21 clinic hours plus 5 hours of didactic classes per week, while CC2 and CC3 students have 21 total clinic hours weekly. Clinic attendance and conduct. Accurate sign-in and sign-out procedures are mandatory. You must remain in designated areas as directed by the clinician during your entire shift. Any departure from the health center during shifts requires permission. Additionally, you may treat patients outside your normal treatment times with clinician approval. Certain hours will be allocated exclusively for educational sessions or meetings, during which no patient care is permitted. Lunch breaks and clinic hours. A minimum 30-minute lunch break is mandatory for any clinical student scheduled for 6 or more hours at any location in a day. These breaks do not count towards clinic hours. When your Dr. X takes a lunch break, you must align your break with his. No hour credits for lunch time. Service hours and policy compliance. Clinic hours can only be earned at designated locations. Service hours apply solely to service activities as detailed in Section 4.2.4 of the Clinic Clerkship Manual. It is critical to understand that falsifying sign-in sheets is considered a severe violation of clinic policy. Double-hour earning, such as being signed in at multiple locations simultaneously, is strictly prohibited. Your adherence to these guidelines is crucial not only for your academic progress, but also for maintaining the integrity of our clinical program. These rules are in place to ensure a fair, productive, and educational environment for all students. Let's commit to upholding these standards as we progress through our chiropractic journey. If you need more information or clarification in any aspects of these rules, always consult an updated version of the Clinical Clerkship Manual available at my SCU, or contact Dr. Sunny or me for updates. Dr. Xavier welcomes you to your SCU Chiropractic Clerkship.